Heart disease remains the leading cause of death in the United States, especially among seniors over 60. And yet many are still unaware how much of a role daily diet plays in either fueling or fighting it. If you live in the United States, Canada, the United Kingdom, or Australia, you've likely heard a doctor mention cholesterol, blood pressure, or plaque buildup at some point. But what if food could actually reverse some of that damage? What if the choices you make at your grocery store every week could mean the difference between a silent heart attack and another 10 to 15 years of quality life? The truth is, every bite we take sends a message to our heart, either a message of healing or a message of harm. And in the United States, where processed foods are often more affordable and accessible than fresh produce, millions of older adults are eating themselves into an early grave without even realizing it. The standard American diet, often called SAD for a reason, is loaded with added sugars, hydrogenated oils, sodium-packed snacks, and inflammatory seed oils that quietly damage arterial walls day by day. But for seniors over 60, switching to the right foods isn't just helpful, it's urgent. Their arteries are already less flexible, their cells regenerate slower, and their heart muscle has already endured decades of stress, inflammation, and oxidation. Let's start with the single most cardioprotective food group that has shown up in almost every large-scale health study in the United States, United Kingdom, Canada, and Australia. Leafy green vegetables. Spinach, kale, Swiss, chard, arugula, and collard greens are all packed with nitrates that the body converts into nitric oxide, a compound that relaxes blood vessels and lowers blood pressure naturally. In one study from the American Journal of Clinical Nutrition, older adults who consumed one daily serving of leafy greens had up to a 26% lower risk of heart disease events. That's not a minor difference. That's potentially a bypass surgery, avoided or a stroke never happening. These greens also contain folate, which helps regulate homocysteine levels, an amino acid linked to arterial damage when too high. Have you ever experienced unexplained fatigue, brain fog, or shortness of breath? Elevated homocysteine may be quietly damaging your cardiovascular system without you knowing it. Fatty fish like salmon, mackerel, sardines, and trout should never be underestimated. Omega-3 fatty acids found in these fish help reduce triglycerides, stabilize heart rhythms, and prevent the formation of dangerous blood clots. In fact, studies from institutions in the United States and Canada have consistently shown that older adults with higher intakes of DHA and EPA, two forms of omega-3s, have significantly lower rates of sudden cardiac death. This is not just about eating healthy. This is about literally giving your heart the raw materials it needs to repair itself. The sad reality is, many seniors in North America are still afraid of fat, clinging to outdated 1980s advice that told them to avoid it altogether. But healthy fats do not hurt the heart. They protect it, cushion it, insulate nerves, and fight the kind of inflammation that leads to arterial blockages and stiffened heart tissue. Berries might seem like a light suggestion, but they are far more powerful than most people give them credit for. Blueberries, strawberries, raspberries, and blackberries are rich in anthocyanins, which improve blood vessel function and reduce oxidative stress. In one major study from Harvard involving over 93,000 women, those who ate 3 or more servings of berries per week had a 34% lower risk of heart attack. Imagine that. A single cup of berries a few times a week offering that kind of protection. They're also low in calories and high in fiber, making them ideal for blood sugar management, something critically important for seniors who often struggle with prediabetes or type 2 diabetes, both of which dramatically increase heart disease risk. Nuts, especially walnuts and almonds, should be a staple in every senior's diet. Rich in monounsaturated fats, magnesium, and vitamin E, Nuts help lower LDL cholesterol, reduce inflammation, and improve arterial function. One study from the United States that followed thousands of people over decades found that those who consumed nuts regularly had a 20% lower risk of dying from heart disease. These are simple, snackable foods that require no preparation. Yet many seniors avoid them because they were once told they were too fattening. The reality is, moderate nut consumption is actually associated with weight loss in older adults, thanks to their satiety factor and ability to stabilize blood sugar. Whole grains, particularly oats, quinoa, barley, and bulgur, are essential for keeping arteries clear. They contain soluble fiber that binds to cholesterol in the digestive system and removes it before it can enter the bloodstream. In the United States, where white bread, sugary cereals, and highly processed grains dominate breakfast tables, many older adults are unknowingly raising their LDL cholesterol every single morning. A bowl of old-fashioned oats with chia seeds and berries can lower cholesterol, balance blood sugar, and offer a heart-protective start to the day. Oats contain beta-glucan, a type of soluble fiber that has been proven in clinical trials to lower LDL levels by up to 10% when consumed regularly. Ask yourself, what's the first thing you eat in the morning? Is it helping your heart or silently harming it? Legumes, including beans, lentils, chickpeas, and peas, are one of the most underrated food groups for cardiovascular protection. They are packed with fiber, plant-based protein, potassium, and magnesium. These nutrients help regulate blood pressure, support healthy cholesterol levels, and reduce the need for red meat, which can be inflammatory and artery clogging if consumed excessively. In the United Kingdom and Canada, some health guidelines now encourage plant-based meals several times per week, specifically to reduce heart disease burden. Yet in many parts of the United States, meat is still the centerpiece of every dinner plate. The switch to beans may feel cultural or difficult for some, but it could literally mean the difference between independence and a heart-related hospitalization. Avocados are another heart health superstar for seniors. They're high in potassium, which helps counteract the blood pressure-raising effects of sodium, and loaded with monounsaturated fat that supports HDL cholesterol. Many Americans still fear dietary fat, not realizing that avocados can actually improve lipid profiles, reduce inflammation, and support the flexibility of arterial walls. In one clinical study, participants who added just one avocado per day to their diet saw significant improvements in their LDL and total cholesterol levels without gaining weight. Seniors in the United States and Australia often experience increased salt sensitivity, which makes the potassium to sodium balance even more critical. Avocados offer a delicious way to achieve that balance while adding creaminess and richness to meals without relying on inflammatory oils or processed spreads. One of the most overlooked but incredibly effective heart-protective foods for people over 60 is garlic. Garlic isn't just a seasoning. It functions almost like a natural medication. Allicin, the active compound released when garlic is crushed or chopped, has been shown in numerous studies to lower blood pressure, reduce LDL cholesterol, and prevent platelet aggregation, which is a fancy way of saying it helps stop blood clots from forming. That's huge for older adults because clot-related events like strokes and heart attacks are often fatal. In a large-scale clinical review, individuals who consumed aged garlic extract regularly had significantly less plaque buildup in their coronary arteries over time. In the United States, where prescription medications dominate cardiovascular treatment, it's easy to forget that something as simple as a clove of garlic can impact the heart just as powerfully, without the side effects. Dark chocolate, when it's at least 70% cocoa and free of added sugars and milk solids, has powerful flavonoids that can reduce blood pressure and improve circulation. Seniors in Canada and the United Kingdom, who incorporated moderate amounts of dark chocolate into their diets, saw consistent improvements in vascular function and arterial elasticity. The key is moderation and quality: low sugar, high cocoa, dark chocolate, not candy bars loaded with sugar and artificial fats. This kind of chocolate increases nitric oxide production in the endothelium, which is the thin layer lining blood vessels, leading to better dilation and blood flow. For seniors dealing with cold hands and feet, dizziness, or cognitive fog due to poor circulation, this could make a noticeable difference in daily quality of life. Extra virgin olive oil, especially when used as a primary fat source instead of vegetable oils, butter, or margarine, has repeatedly shown to slash the risk of heart disease. A landmark study from Spain, often cited in U.S. cardiology journals, demonstrated that older adults who consumed about 4 tablespoons of olive oil daily had a 30% reduction in major cardiovascular events. In the United States, where vegetable oil use is widespread and often advertised as heart-healthy, it's important to recognize that most of these oils are highly refined, oxidized, and inflammatory. Contrast that with extra virgin olive oil, which is cold-pressed, rich in antioxidants like polyphenols, and supports HDL cholesterol while reducing LDL oxidation. That oxidation is what triggers plaque formation in the arteries, leading to heart attacks, strokes, and the need for surgical interventions like stents or bypasses. One thing often forgotten in heart health discussions is hydration. Seniors, particularly in the United States and Australia, are often chronically dehydrated. As people age, their sense of thirst diminishes, even when the body needs water. Dehydration thickens the blood, increases blood pressure, and stresses the cardiovascular system, especially during hot weather or physical activity. A well-hydrated bloodstream flows more easily, supports kidney function, which directly impacts blood pressure, and prevents the buildup of waste products that can lead to vascular inflammation. For seniors on multiple medications, many of which cause dehydration or increased urination, this becomes even more critical. Aim for water, herbal teas, or water-rich foods like cucumbers and melons instead of sodas, sweetened juices, or artificially flavored drinks that contribute to inflammation and blood sugar spikes. Turmeric, especially when paired with black pepper, to enhance absorption, is another potent anti-inflammatory spice that has a direct effect on cardiovascular health. Curcumin, the active compound in turmeric, has been shown to reduce systemic inflammation markers like CRP, which are closely tied to heart disease progression. In several studies from the United States and Australia, older adults taking curcumin supplements experienced improvements in arterial function and even reductions in plaque thickness. This matters because silent inflammation is a hidden cause behind a lot of heart issues. If you're over 60 and you've ever dealt with chronic pain, stiffness, or unexplained fatigue, there's a good chance you're dealing with internal inflammation. Turmeric isn't just for joints. It calms the immune system and helps the heart by reducing oxidative stress and inflammatory cytokines that can damage blood vessels. Citrus fruits like oranges, grapefruits, lemons, and limes offer more than just a dose of vitamin C. They're rich in flavonoids, especially hesperidin, which improves blood vessel flexibility and reduces blood pressure. In population studies in Canada and the United Kingdom, seniors who regularly consumed citrus fruits had healthier arteries and lower levels of inflammatory biomarkers. However, seniors on certain heart medications, especially statins or blood pressure pills, should consult their doctor before consuming grapefruit, which can interfere with liver enzymes and affect drug metabolism. For everyone else, these fruits are a powerful way to enhance circulation, improve immunity, and reduce risk of blood clots, which are more common in older adults due to slower circulation and sedentary lifestyles. Seeds like chia, flax, and hemp are small but incredibly dense. in nutrients that matter for heart health. They're rich in omega-3 fatty acids, soluble fiber, and plant-based protein. When mixed with water, chia and flax form a gel-like substance that helps regulate digestion and slows down the absorption of sugar, which is crucial for blood pressure and blood sugar balance. In the United States, where insulin resistance and prediabetes are widespread in older populations, these seeds offer a simple way to combat metabolic syndrome, which directly contributes to heart disease. Adding a spoonful to your oatmeal, smoothie, or salad can lead to meaningful improvements in triglycerides, HDL cholesterol, and blood pressure within weeks. Beets, especially when eaten raw, juiced, or lightly roasted, are another nitrate-rich food that supports blood vessel dilation and endurance. In clinical trials from Australia and the United States, seniors who consumed beetroot juice experienced lower blood pressure and increased walking distance before fatigue set in. This matters deeply for older adults who want to maintain independence and avoid mobility decline. If walking from the car to the store leaves you winded, or if your legs ache after just a short distance, impaired circulation could be the cause, and beets might be part of the solution. They also help oxygenate tissues by increasing nitric oxide availability, which supports not just the heart, but also brain function, making them doubly beneficial for seniors at risk of both cardiovascular and cognitive decline. Fermented foods, like kimchi, sauerkraut, and kefir, aren't just for gut health. They also have a profound effect on inflammation and lipid profiles. The gut microbiome influences everything from cholesterol metabolism to systemic inflammation. And studies have shown that seniors with a more diverse gut flora tend to have better heart health. In the United Kingdom and Canada, where fermented, dairy-like yogurt and kefir are more commonly included in senior diets, researchers have seen lower rates of metabolic syndrome and hypertension. The United States is catching up, but many older Americans still rely heavily on antibiotics, processed foods, and low-fiber meals, all of which destroy gut bacteria and create an inflammatory environment that promotes plaque buildup in arteries. A daily serving of probiotic-rich foods can help restore balance, reduce CRP levels, and improve overall cardiovascular resilience. For seniors dealing with chronic conditions like high blood pressure or high cholesterol, the temptation is often to rely solely on medication. While pharmaceuticals play a role, especially in high-risk individuals, no pill can undo years of dietary neglect. The typical U.S. senior takes at least 5 prescription medications daily, often including statins, blood thinners, and antihypertensives, all of which manage symptoms but don't treat root causes. A dietary shift, on the other hand, can directly influence the mechanisms that lead to heart disease in the first place. Even modest improvements, like swapping margarine for olive oil, soda for herbal tea, or red meat for lentils, can compound over time and create massive health improvements. Seniors who make these changes often report not just improved lab numbers, but also more energy, better sleep, less pain, and greater mobility, things that no medication alone can promise.